Listen, misinformation spreads faster than gossip at a family barbecue. But today, we're setting the record straight. No judgment, no shame, just facts. Let's roll. When it comes to sexual health and STIs, myths are everywhere. Maybe you've heard one from a friend or read something questionable online, but misinformation can lead to unnecessary risks. The truth, understanding the facts, is the best way to protect yourself and stay informed. So, let's clear things up. Here are 7 common STI myths and the real facts you need to know. Myth: if I had an STI, I would know about it. Unfortunately, this is not always the case. Many people with an STI do not show any symptoms of an infection. In fact, around 80% of women and 50% of men do not show any signs of chlamydia. Regular testing is always advised to make sure an STI does not go undetected. Myth: an STI will eventually disappear without treatment. An STI will not go away by itself. However, most STIs can be easily treated and cured with a course of antibiotics. Early detection is important. The longer an infection is left untreated, the more serious the potential health implications become. These health risks vary depending on the type of infection, ranging from infertility, pelvic inflammatory disease, PID, and damage to vital organs in the body. Myth: a swab test is painful and embarrassing. Getting tested can feel a little intimidating, but the truth is, it's quick, easy, and completely painless. If the thought of a swab makes you uncomfortable, just remember that healthcare professionals do this all the time. There's no reason to feel embarrassed. Prioritizing your sexual health is a smart and responsible choice, and that's what really matters. Myth: STIs only affect young people who have sex with multiple people. As the saying goes, once is enough to catch a sexually transmitted infection. Anyone who is sexually active is at risk of catching an STI, no matter their age, gender, or sexuality. STIs do not discriminate, and nobody is immune. Myth: if I use a condom, I am protected against all STIs. Apart from abstaining from sex, condoms are the most effective method to prevent STIs. However, they are not 100% effective and do not cover the whole genital area. It is possible to catch some infections, including herpes and syphilis, through skin-on-skin contact alone. Myth: you cannot catch herpes from someone unless they are having an outbreak. Herpes can be spread even when a person has no visible symptoms. This is known as a process called asymptomatic viral shedding. It most often happens in the early stages of infection and just before or after an outbreak. It's your turn. Stay informed, get tested, and help spread the truth. Let's break the stigma and keep the conversation going.